I'm bringing management of the NHS back into democratic control by abolishing the arm's-length body NHS England. That will put the NHS back at the heart of government where it belongs, freeing it to focus on patients, less bureaucracy, with more money for nurses, an NHS refocused on cutting waiting times at your hospital.
Today, we're diving into a major announcement that's stirring up a lot of discussion in Britain's healthcare scene. In a surprising speech on Thursday, Mr. Starmer revealed that NHS England is about to be scrapped. But before you start worrying about the future of the NHS, let's break down exactly what this means. First off, it's important to note this isn't about getting rid of Britain's National Health Service, the cherished system that provides free healthcare funded through taxes and payroll deductions. Instead, what's on the chopping block is an administrative body, NHS England, which was set up in 2013. So, what's NHS England all about? It was created to work alongside the government on funding and setting priorities for the NHS. It operates separately from the main health ministry, the Department of Health and Social Care. Currently, it employs around 15,300 people. According to Mr. Starmer, having NHS England and the Department of Health operating as separate entities has led to a lot of duplication. Imagine having two separate communications teams or strategy teams doing the same job. It's not the most efficient use of resources. The plan is to merge some of these functions, transferring many roles over to the Department of Health. Health Secretary Wes Streeting mentioned that this change is expected to save hundreds of millions of pounds a year and could cut the overall workforce by up to 50%. But details on exactly how many jobs will be cut versus transferred remain a bit unclear.
Over the next 2 years, NHS England will be brought into the department entirely. These reforms will deliver a much leaner top of the NHS, making significant savings of hundreds of millions of pounds a year. That money will flow down to the front line to cut waiting times faster and deliver our plan for change. By slashing through the layers of red tape and ending the infantilisation of frontline NHS leaders, we will set local NHS providers free to innovate, develop new productive ways of working, and focus on what matters most, delivering better care for patients. Madam Deputy Speaker, I cannot count the number of Conservatives who have told me in private that they regret the 2012 reorganisation and wish they had reversed it when in office. But none of them acted. They put it in the too difficult box, while patients and taxpayers paid the price, because only Labour can reform the NHS. And Madam Deputy Speaker, the government is proving that only Labour can be trusted to reform the state. The Prime Minister has committed to cutting the number of quangos. Today, we are abolishing the biggest quango in the world.
This isn't the first time Britain's health system has seen big changes. Back in 2012-2013, the government initiated what's known as the Lansley reforms, named after former Conservative Minister Andrew Lansley. Those reforms were widely criticised and have been slowly unwinding over time. Today's announcement might just be the final step in that long process. Mr. Starmer argues that scrapping NHS England will return democratic control over the health service, allowing more funds and attention to be directed to patient care. With millions waiting for medical procedures and a system that's been underfunded for years, every bit of efficiency counts. But there's more to the story. This move fits into a broader government agenda aimed at slimming down the size of the state and streamlining service delivery. It's about cutting out duplicated efforts that bloated the bureaucracy, a plan some compare to efficiency measures seen in other countries, though here it looks more like gentle pruning rather than deep cuts. Of course, any major shake-up comes with its share of risks. While trimming duplicated roles in healthcare might be popular, there's concern over broader changes to the welfare system. Some lawmakers worry that reducing welfare support, especially for disabled individuals, could echo the harsh austerity measures of the past. However, Mr. Starmer has been very clear. Under his leadership, there will be no return to austerity. So, what's your take on these sweeping changes? Do you think merging these administrative bodies will free up more resources for patient care? Or are there potential pitfalls we need to watch out for? Let us know in the comments below. If you enjoyed this breakdown, hit that like button, Subscribe for more in-depth analysis and ring the bell to stay updated on all our latest videos. Thanks for watching, and we'll see you in the next one.